If you are on Medicare or will be switching over to it soon, today's episode is for you. Christee from the team here at Searns Financial Group, who is focused on helping our clients with their Medicare decisions, joins me on the show. She talks about reasons why you want to review your Medicare plan annually to help make sure you are getting the coverage you need, ability to see the doctors you want to see, and make sure prescriptions that you need are covered. She covers base Medicare, Medicare supplements, and Medicare Advantage, and the pros and cons of each, and then also why consumers should be very careful and cautious regarding the Medicare advertisements that they hear on the radio or see on TV.
Welcome to the Your Life, Your Money podcast with Scott Searns, teaching you how to thrive in life, wealth, and retirement.
Welcome to another episode of The Retirement Show, all about your life, your money, and we also like to talk about your taxes. I'm your host, Scott Searns, President and Financial Advisor at Searns Financial Group. And on today's episode, I actually have a team member with me. I've got Christee on the podcast as well as our guest to talk all about Medicare planning and enrollment. Medicare is a big part of retirement. Also, it's a cost that cuts into people's retirement income. So it's a service that we offer to all of our clients as we know that Medicare is going to play a huge role in their future. So, Christee, welcome to the podcast.
Yeah, thanks for having me. Glad to be here.
I'm really excited. All we're hearing about on TV, on the radio now, is all about Medicare. And so I'm super excited just to have you on the podcast to help people understand more about Medicare because it's complex. It can be complicated. We've had lots of clients come in and say it can be and feel overwhelming because of the different options and what they hear from their neighbor or what they hear on TV or what they read on a website. And so I think today is a great way just to kind of slow all that down and help people understand some of the basics and why they might, lean one way when it comes to Medicare supplements, lean a different way if it comes to Medicare Advantage, and just the difference between the two. And there's pros and there's cons and go through all of that. So really excited. Thanks for joining us. And let's just kick it off. When it comes to Medicare, we're hearing all about this right now, AEP. What is AEP and what's going on in the Medicare world right now?
Yeah, it means it's a busy time in the Medicare world, absolutely. So AEP is the annual election period. It happens once a year from October 15th to December 7th. And that's when the time of the year where you can make changes to those Medicare Advantage plans and prescription drug plans. So every year, the Medicare Advantage and prescription drug plans roll out new plans, and they release these plans on October 1st. But you, starting then October 15th to December 7th, like I said, you can enroll in these plans, or you can change your Medicare Advantage plans, or you can enroll in a prescription drug plan, or change your prescription drug plan during that time, and then those new benefits then would begin on January 1st of the new year once you enroll during that annual election period.
Okay, and so let's just say, I've got a Medicare plan in place. Why should I be paying attention right now? Why would I want to review? I mean, if I've put something into place, am I set for life? Should I just be good? Should I let it, continue to roll from year to year to year? Why do our clients, people that are listening to this, why do they need to pay attention right now?
That's a great question. And the thing is, things change, right? Things change in our life. And I think it's good every year to just put a thing on your calendar that every year you should review your Medicare plan because your needs change, your health changes, your just whatever situation you're in changes. And you know what? It's good to review anyway. Sometimes you may stick with the plan you're on, but sometimes you may want to change for various reasons. The thing is, as I mentioned, Medicare Advantage comes out with new plans every year. So let's say you're currently on a Medicare Advantage plan. Well, you know what? There may be an even better one out there that you could enroll in. That's one reason. Sometimes your Medicare Advantage plans, your primary care physician may no longer be on the plan, or your prescription drugs may no longer be covered in the list in what's called the formulary. So these are things you want to check every year to make sure your doctors, your pharmacies, hospitals, your prescriptions are all still included in your Medicare Advantage plan. And then on the Medicare supplement side, I would say it's good to do, a plan review every year, because there could be a lower premium that you could possibly get with a different carrier, a different insurance company. So no matter what, it's just good to review your plan, make sure you're on the best plan for your needs. And that's what I do. And that's what I'm happy to help clients with, is they can give me a call, send me an email, and I'm happy to look over their plan at no cost to them and make sure that they're in the best plan possible for their needs.
And what if I am, a lot of times retirees are traveling, or sometimes once people retire, they love to move from one state to another, right? We're in Illinois, and it's pretty cold here in the winters, and people love to just go to those warmer weather states. So if somebody's moving, is that like something that they need to check up on this? Does that impact it at all? Does it travel from state to state? How does that work?
Yeah, a couple things that's important for that specific person to know. First of all, if that particular person who is moving around is on a Medicare Advantage plan, Medicare Advantage plans use a network of doctors and hospitals. So if you are moving, well, that network of doctors and hospitals that you had at your primary residence you won't be able to use those same doctors and hospitals when you move out of the area. But it's also important for those people to know that a Medicare supplement plan does give you the flexibility to see any doctor in the country. So if there's a scenario where people like to travel and things like that, that would be a situation where I would recommend a Medicare supplement plan. But whatever situation you're in, whether that's a supplement or a Medicare Advantage, that's something important to know if you are moving around or you are moving residences.
And I know that, and I'm going to then go back to a few things that you said earlier, a few items. I know that when you're working with our clients and they email in or call in and said, yes, we'd love to have you do a review. Maybe it's a new client we met, so we're not already working or, helping them with their Medicare plan. So a new client that you've met, they're calling in and saying that they'd like to have you review their Medicare plans. A lot of times you're asking them for their health information because, like you've said, if their health has changed or their prescriptions have changed, you've got that ability, right, to plug all of that in just to make sure that they are on a plan that's still proper for them. And then the second part that you had said that I think we kind of lose track of is it's complex, it's overwhelming sometimes, or it feels that way when it comes to Medicare because we're just getting inundated with information from so many different parties, is that once we do it, we're just like, okay, it's done. And it's sometimes, those complex things, we just don't want to go back and approach them anymore. But it's really similar, correct me if I'm wrong here, to like car insurance or home insurance, where when you got your policy, you got it from a carrier at that point in time that you thought was giving you the best premium for the coverage that you wanted. And over time, that carrier might no longer have the best premium for that coverage. And you can go and search other carriers. And we're just talking, let's say, home insurance. Well, if your home's insured for the same price across 5 different carriers, you're going to go with the one. And if they're all highly rated, all provide really good service, you're going to go with the one with the lowest premium. And I'm thinking, and this is what you can, help me understand, but are you seeing the same from a Medicare standpoint that, hey, you've got a multitude of carriers, same type of coverage, and then the premium changes? And maybe that's different from Medicare Advantage to Medicare Supplement, but is that what you're also helping clients with?
Yes, and you said it right there. The coverage is the same for the various insurance companies, and that's what we're finding with a Medicare supplement plan. So Medicare supplement plans are federally regulated. They are called standardized plans. They are your numbered plans. So if you've heard of the Plan G, the Plan N, and they are standardized, and what that means is Plan G with one insurance company is the same exact coverage of Plan G with another insurance company. So it's standard across the board. So the only things determining your premium for a Medicare supplement is where you live, because we enter your zip code. So it's where you live and what insurance company you go with. And whether you get Plan G with one company or another company, your coverage and your benefits are the exact same. So that's why it's important, just like you said, home insurance, shopping around, spending that one time every year to make sure that if you are, for example, on a Medicare supplement, that you're getting that lowest premium. Because if you move to another insurance company on the same plan, you're still getting the same exact coverage you have.
Okay. Now, let's move on, because we've now been talking about Medicare Advantage and Medicare Supplement and back and forth and back and forth. And I think that's where a lot of confusion sometimes comes in, is what's the difference? And do you mind just kind of breaking that down? What's the difference between Medicare Supplements and Medicare Advantage, and what's the pros and cons of each?
Yeah, and it can feel overwhelming, right? There's just so much information out there and so much information about the two. And that's something I walk through with clients, is I like them to have a very unbiased kind of description of both parts. And that's what I'm happy to do and happy to explain.
Because everybody's unique, right? They all have a
Right.
different path that they might want to go down, and everybody's health scenarios are different. Everybody's financial scenarios are different. And a lot of times too, what just people want to have covered, while somebody might, you'd kind of think, oh, well, you're a perfect fit for this. They might like the lower cost option, or they might, they are super healthy, but then they could be like, yeah, but I want the full on coverage. So I'm glad that you said that. Yeah, it just, everybody is so unique in what they might want or need. So sorry to interrupt you, but
No
yeah,
problem.
what's the differences here?
Yeah, so we've got let's start at the top. We've got what's called Original Medicare. And Original Medicare is made up of Parts A and Part B. So Part A is going to be your hospital insurance. So that's going to cover if you end up in the hospital. So your inpatient care in a hospital, a skilled nursing facility, hospice care, home health care. And for most people, that is going to be a $0 premium, because they have paid those Medicare taxes. And while they've been working, and as long as you've worked at least 10 years, when you get Part A, when you are eligible, that comes with a $0 premium. And then there's Part B. So whereas Part A is your hospital insurance, Part B is your medical insurance. So that will help you cover services from doctors, any outpatient care, and other preventative services such as wellness screenings or vaccines. Now, whereas Part A came with a $0 premium, Part B does carry a premium. And for the year 2023, that standard monthly premium for Medicare Part B will be $164.90. Now, that is the standard monthly premium. That does change if you are a high income earner. You are subject to this IRMA, the income related monthly adjusted amount. But right now, the standard monthly premium for Medicare Part B is that $164.90.
And just to interject really quick, that's something that I know that people aren't always aware, that based on their income, and it's a 2-year look back, correct?
Right,
So your
yes.
income for, let's say we're in 2022, so that income for 2022 is actually governing what their 2024 Medicare rates will be. And I know that's something that you and I are always collaborating on as we're helping clients out, because that is something that if you're in high income years, right prior to retirement, you could be looking at increased Medicare Part B and Part D premiums. And there are, you always will have your income. So it's not necessarily ways to get around it, but there are ways to maybe potentially avoid it in the long term. And so it's just working through different tax strategies to help reduce that over the long term. So sorry to interrupt, but I think it's just really important that people understand that, because otherwise you look at your Social Security, where a lot of times people have their Medicare deducted from. They're like, why is it so much? It's more than that standard amount that Christee just said. Well, that could be why. And I think it's just really important to understand that.
Mm-hmm. Absolutely. And so a lot of people think, oh, well, if Part A covers hospital insurance and Part B covers medical insurance, well, then that's all I need, right? Just Part A and Part B. And I explain, well, Part A does come with a $1,600 deductible. That means that you must first pay $1,600 out of your own pocket before Medicare starts to pay. So you've got this added cost, right? We call this a gap in Part A. And then in Part B, with this medical insurance, Medicare covers 80% of your medical insurance rather, and you have to pay the other 20%. And the thing to note about that is uncapped. So let's say you end up in the hospital, something happened, and you have a $100,000 hospital bill. Medicare picks up 80% of it, $80,000, $20,000 is left to you. And sometimes that can be really, really hard on a person and really drain a lot of their savings. And so even though this Part A and Part B that Medicare has is great, there are these gaps. So there's the $1,600 deductible, there's the 20% coinsurance in Part B that you have to pay. So that is why after Part A and B, we then have this choice. We have this choice to make. It's kind of like, okay, which road are you going to go down, right? Are you going to turn left and go down the Medicare supplement route, also called the Medigap plan, or are you going to go right and go down the Medicare Advantage plan? And like anything in life, there's pros and cons to both. And let's say you choose to go left and you are going down the Medicare supplement, also known as the Medigap plan. That plan is intended to come in and fill those gaps that I just mentioned. So you would still have your Part A and Part B, you'd still pay your Part B premium, but a Medicare supplement comes in and fills that $1,600 deductible from Part A and also fills the gap of that 20% coinsurance from Part B. So that is the purpose of the Medicare supplement plan, whereas the Medicare Advantage plan, that is going to be, I kind of think of it as like an alternative way to receive your health care. It's going to be through a private insurance company. And I kind of think of it as a managed care plan. So they're going to be taking over and they're going to be managing your care. And so as I mentioned, there's pros and cons to both of these, right? So with the Medicare supplement, what a lot of people like about that is one thing about a Medicare supplement plan, you have the flexibility to go to any doctor in the country that accepts Medicare. And that's a whole lot of doctors, actually. Whereas the Medicare Advantage plan, as I said, that's more of a managed care plan. That's going to have a network of doctors and hospitals. And I had also mentioned that earlier. So there are more restrictions, including in that Medicare Advantage plan, there's also going to be referrals or prior authorizations that will be required for various procedures. Whereas a Medicare supplement, you don't have to get the prior authorizations or the referrals. So it's a little less restrictive than that Medicare Advantage plan.
So the Medicare Advantage, then, are you kind of saying that's like if a person was working for maybe a corporate employer, that's kind of like their HMO corporate employer type or like plan? Is that pretty similar to what if they're on an HMO, it'd be pretty similar to that? Yeah,
with having those networks.
Okay.
And absolutely. Yep. So there's Medicare Advantage HMOs and PPOs, and those are things that I'm happy to look at for clients. One thing to note, though, is that Medicare supplement plan will carry an additional monthly premium. So you would pay in both Medicare supplement or Medicare Advantage. For both of them, you would pay your Part B premium, but for a Medicare supplement, that's going to come with an extra monthly premium. And for that cost, it really depends on where you live. That cost varies around the country. But for a Medicare Advantage plan, what a lot of people like is that either comes with a low premium or even often a $0 premium. So definitely really attractive for a lot of people, right? They see that $0 premium versus why do I want to pay for a Medicare supplement plan? But pros and cons to both. Another thing is with a Medicare Advantage plan, a lot of times with that plan, You can also get a prescription drug plan bundled in, and a lot of times even a dental or vision or hearing plan. So I kind of think of it as all a little bundle. Whereas if you go with the Medicare supplement route, you would have to pick up a standalone prescription drug plan. And if you did want those added benefits of the dental or the vision or the hearing, that would be an additional plan. So, and oftentimes that's with different insurance companies, right? So you'll get a Medicare supplement with one insurance company, a prescription drug plan with another company, and a dental vision plan with another company. Whereas a Medicare Advantage, it's bundled, and a lot of people like just carrying around one card. So they use one card at, the doctor or the pharmacy or at their dentist. So it's all kind of, whatever your preference is and what your situation is.
And we mentioned earlier, everyone has their own unique scenario. And you were starting to kind of say, hey, for people who like to travel a lot, maybe they want to go down the Medicare supplement route. And I know that there's no, this is the exact person who needs a Medicare supplement, and there's not, this person needs, Medicare Advantage. But if you were to say maybe who would be a good fit, if somebody's just kind of listening right now going, yeah, but I wonder where I kind of fit, what would you say maybe is that good fit? And I know we always get surprised, right? Because some people come in and then they're talking to us about it, and they maybe have in their mind the coverage that they want. So that's why you go through a process with people that has steps to it to help them determine which path that they want to go down. But other than just, hey, they like to travel a lot, what else would maybe make a person a good fit for a Medicare supplement? And then, of course, I'm going to ask you that same question for Medicare Advantage.
Yeah, great question. I mean, there's so much that goes into it and so many things we go over with clients. And one thing with that Medicare supplement is for people who they just want to know. They just want to know what they're going to pay every month. They can budget for it. They know they're going to have to pay their Part B premium. They know they're going to have to pay their monthly premium for their Medicare supplement plan, their monthly premium for their prescription drug plan, possibly that dental vision plan. And then beyond that, I mean, other than a Part B deductible that they'd have to pay of $226, they have comprehensive coverage, and they know after they pay that, they're covered. And it gives people that peace of mind. They can budget for it. They know exactly what they're going to pay monthly, and they're not going to have added medical costs after that. They're going to be pretty much covered 100%.
So back to those company health plans that they might have used to, is it might have said, your out-of-pocket max is $5,000 or your out-of-pocket max is $7,000. They don't have to worry about that. Then they've already budgeted. They know what their comprehensive plan is, and they've got comfort just knowing what those numbers are, and they can move forward, and they know from a health standpoint how they're covered.
Right. Other than that monthly premium and that Part B deductible of $226, they're going to be covered, and they're going to have nice comprehensive coverage. Now, you did mention an out-of-pocket max. That's your Medicare Advantage plan. So yes, it does have this attractive $0 monthly premium. But those plans, you are going to pay your co-pays at the doctor, your co-insurance, and it does come with an a maximum out-of-pocket cost. So with that, it's a little bit like, well, when I do go to the hospital, then I'll pay. Mm-hmm. Now, I don't know how much I'll eventually have to pay, like the Medicare supplement. You just know your monthly premiums. So for some people, well, they know there's a maximum out-of-pocket, but they don't know how much of that they'll actually reach,
Yeah, and like I said, very unbiased approach. And who then is that good fit for Medicare Advantage? And of course, everybody's got a unique scenario, but maybe they can walk their own minds down that path.
Yeah, and that's what I'm happy to talk to people about too, in your unique situation. But let's say there's someone who's currently on an employer health plan, and it is an HMO, and they say, you know what, Christee, I am fine using my network of doctors and hospitals, and I already do that. It's already an HMO. And honestly, an extra monthly premium with everything I want to do right now in my life, it's also really hard to pay that extra monthly premium. So I think I want to go with a $0 premium right now. I'm fine with a network of doctors. I'm healthy. I'm not on a lot of prescriptions. For that type of person, Medicare Advantage be a good plan, but I also, and I try to give an unbiased opinion on both of them, but I do tell them, that's great for your needs right now. That's great. But one thing I need to make sure to point out that if they want to switch to a Medicare supplement at any point in time later down the road, they will have to pass through health questions, which is called medical underwriting. And it's just something to make everybody aware of, that if you do switch from Medicare, if you think, oh, I'm 65 and healthy and not on any prescription drugs and I'm fine going to my doctor right now and I don't really get a lot of tests, so I don't need a lot of prior authorizations or referrals, but I make sure to let them know that if they do make that switch later on, they will have to pass through health questions to be able to switch to that Medicare supplement plan. But now the reverse, Medicare supplement to a Medicare Advantage, you actually never have to go through those health questions, medical underwriting. You can switch to a Medicare Advantage plan as long as it's during the annual election period, which we have now.
Well, good to know. And then, and I think that's important to understand, and I'm just going to put this out there, is we always want to make that change after our health switches. And so I think it's just important to understand, at whatever age you're listening to this show right now, if you're in good health, but maybe you're in your 80s and you've been on Medicare Advantage, maybe it's a good time then, while you're actually in good health, to then review and look at alternative plans, because once your health switches, that's when things change. That's when premiums could potentially go up. And that's why we'll always kind of, what would you say, nudge people a little bit, if to, at least give it thought of, should you be making a change if you've, lived a long, healthy life, but you've been on Medicare Advantage. Maybe there is a point in time where you need to think about it anyways.
Yeah, and at least I let all the clients know that, and at least they have the information then to make an informed decision what's best for them.
Great. Now, you mentioned prescription drug plans earlier, and they're sometimes included in one or have to get it separate in the other. What is a prescription drug plan? Because we were talking a lot about parts A and B earlier, and what is it, and does somebody need to have it, and any thoughts just overall on prescription drug plans?
Yeah, so just talking about, whichever way you go, whether left or right, and the Medicare supplement or Medicare Advantage route, if you go the Medicare Advantage route, I love finding a plan for my clients where that prescription drug plan is bundled in with their Medicare Advantage plan, still with a $0 premium, I might add. And then if they're going the Medicare supplement route, I say, all right, it's best to pick up a separate prescription drug plan. And like I said, we can go through a different insurance company for that. Well, the reason I say we have to do this is because, believe it or not, if you don't sign up for a prescription drug plan when you are first eligible, you face a lifetime penalty where you will have to pay if you don't pick up that prescription drug plan. So if I meet with clients and they say, but Christee, I'm not on any prescription drugs, why do I have to pick up this prescription drug plan? And I explain the lifetime penalty that they would face. So in a situation like that, I say, okay, my goal is to find you the least expensive prescription drug plan because I know you have to have it. And there are definitely low expense ones out there that I work with clients to get set up. But basically how that works, though, back to your question, is that is one thing that I get from my clients is their list of prescription drugs, because the worst thing I can do is put them on a prescription drug plan that doesn't even cover their prescriptions. So, and the plans differ in what drugs they cover, called the plan's formulary. So I enter all the prescription drugs and I make sure that you are on a plan that does cover those, or at least covers them with the lowest annual cost for you.
Okay. And then one of the things that we talked about at the beginning was why right now Medicare might be on everybody's mind, because of the TV commercials, because of the radio commercials. I think anywhere you turn, heck, it probably, if you're searching on the internet, it's going to pop up on the side on an ad to tell you about...
It's everywhere, right?
It's everywhere.
Especially
Medicare,
right now.
Especially right now. And there's a lot of enticing ads, or some ads have celebrity endorsements, which really then make people go, oh, well, if so-and-so says this is the one, then maybe I should think about that. So when it comes to all of these ads, what should consumers be watching out for?
I'm so glad you asked about this, Scott. It's something we're seeing right now all over TV and things in the mail and all these advertisements. And I just remind people they are advertisements, and the purpose of them is to entice you, and especially to create this sense of urgency that you feel like you have to pick up the phone because you're going to miss out if you don't pick up the phone right now. And
just get your attention.
Right.
I mean, that's the world anymore. How can I make you stop scrolling, stop what you're doing, and I want your attention?
And the thing that's tough about that is when you pick up the phone and you call these companies, just reminding everybody that you are calling a call center. You're talking to somebody at a call center who is talking to people all day with different situations. And I just wonder, are they getting down your prescription drugs, as I said before, to make sure they are covered on this plan? Are they making sure your doctor is in network? Your hospitals are in network on this Medicare Advantage plan. And the thing about working with an independent like me is I have access to a whole bunch of insurance companies and their plans, and I can make sure that based on your specific need that you are enrolled in the best plan for you. Whereas with the call center, you're calling one company, so that person who picks up the phone only has access to a few plans in the area.
A lot of times too, isn't it the fine print? It says like, oh, this one cost nothing, or this one, and then fill in whatever enticing ad, but the fine print might say only for people in Florida, and they're playing the ad in Illinois or wherever. I mean, I might be far-fetched in that one, but that's what's happening, correct?
Yeah, they offer you the moon and the stars, right,
Yeah.
in that commercial. And they can, because technically they're not lying, because in one zip code in Florida that does apply. So it's the whole, bait and switch technique, right? They baited you in, and now they're going to switch it to a new plan and say, oh, just kidding. Actually, we can't offer you that. So, it's just something to keep in mind when you're calling that person from the call center. Also, you're never, if you wanted to call them back again, you're never going to be able to get a hold of the same person. And that's why a lot of people like working with me, is they know, oh, I can always just send Christee an email, right? Just send Christee an email. I'm Christee at SearensFinancialGroup.com. And they can reach me at any time and ask questions. And it's not like I'm here one day and gone the next, like these call centers would be. And it sounds enticing. I get it. It does. But, we also offer great plans, sometimes even better plans, because we have access to so many more companies. And just keep in mind, their goal is to create this sense of urgency in you. And just keep that in mind.
And I know that rather than urgency, you have a very structured process that you walk through, not only with our existing clients, but if new clients want to, reach out as well. Do you mind if, let's just stay on the kind of the annual election period here. That means somebody's already on a plan, whether it be a Medicare supplement or Medicare Advantage, or they're even thinking, I don't even know if my prescription drug plan is right. Just as we talked about from that beginning spot, now is a good time to review. Do you mind just walking through what a structured process looks like to help people understand that if they're on the plans that are the best fit for them, great, we're going to let you know that, or down the route too of, hey, here's some other options that you might want to consider. So if somebody reaches out to you, what's the process from there?
Yeah, I first like to ask them about, what do they like about their current plan? What plan do you have now? And what do you like about it? Because I want to make sure that if we do go with another plan, that the things that they like, we're still getting those things. And then I also like to ask, is there anything that is not working out for you? Maybe it's that they're on a new prescription and they want to make sure they're on a prescription drug plan that includes that. Maybe they now need to go see a specialist because their health is changing. So I do ask those health questions. I do ask about their current plan. I do ask if they like that plan and would like to stay on it. So let's say they want to stay on that Medicare supplement plan. I do ask, have you moved? Are you still at the same location? And then basically my goal and the challenge that I love is, can I get them a lower premium? Because if they are on, let's say, Plan G, again, that plan is standardized. And if I get them with another company, well, that Plan G is still Plan G. It's all about that lower premium as long as we pass those health questions. So, you know what, Scott, that's the challenge I love, coming to see if I can find a lower premium. And then
just not only a lower premium, because I know one thing that you take pride in too is a lower premium, but also with high-rated companies. So lower premiums, but we're focused on those A-rated companies because we want to make sure that clients and new clients also have great service as they're coming in. Not only great service from us, but great service from the carriers that they're working with. So I know that lower always sounds like an enticing word, but I think that it's important that people know that, because I watch you work with people each and every day, that it's important that they also know that that's just not the full focus, that there's a whole list of things that you're looking at when you're trying to help people out from that standpoint.
Right.
So,
and we're only enrolling in A or A plus rated companies. Absolutely. I would never put a client with a company that was not rated at the top.
You got it. So sounds like they reach out. We're talking, you're going to get back to them in regards to, sounds like health questions, what they like about their plan, what areas that they would want to change. Health questions, I think I already said that, but then list of prescription drugs. So I think sometimes, it's just important that people realize that for you to properly do your job, yes, you need to know a little bit about their lives, and that's from a health standpoint. Obviously, everything that you work on stays 100% confidential between you and the clients. And then, okay, so you get all of this information from them. Then you said from there, that's the part that you love is, hey, looking out to look at all of the different options that are available for them and understanding that, hey, sometimes it's just getting back to them to tell them you found the right fit, the right plan for you, and you need to stay exactly where you're at. Or it's, hey, we've got some alternative options for you that you might want to consider. And when you have those alternative options, then what takes place after that?
Yeah, so once I do my, work behind the scenes, then I would let that person know if, you know what? Yep, you're on the best plan for your situation. I'm 100% honest about that. Or I may say, you know what? I think I found something and I'd like to show you. I'd like to show you what I found. There is absolutely no obligation to enroll. And by the way, my service is at no cost to anybody. So if I review plans or enroll people in plans, there is absolutely no cost to work with me. So I just want to mention that. And then if I do find a better plan, then I say, hey, let's set up a Zoom call. I'd love to show it to you. And that's what we do. We set up a Zoom call and I show them what I found, and then they can decide whether to go with the new plan or take my suggestion.
And then you're just able to actually help them enroll right on the screen if they want to move forward, right? You make it just nice, simple, easy for them so they don't have to worry about trying to figure out on their own. You walk them through the questions that they might need to answer, but you're doing all that together. So that way they've got somebody with them to help them answer some of those questions that sometimes just seem confusing.
Absolutely. Right there on the screen on Zoom, I'm sharing my screen. We're going through the application together. I'm there to help you every step of the way and walk with you through the process.
Great. Well, I know you mentioned it earlier, but one more time, in the event that we can be of help and service to somebody that's listening to the show, what is a great way to get a hold of you?
Yeah, absolutely. I'm very, very happy to help. My email is Christee@CristineFinancialGroup.com, and that's spelled CHRISTEE @CristineFinancialGroup.com, but we'll also link it
in the show notes.
Yep.
Yeah. So we'll have a link to that in the show notes. You can go to lifemoneyshow.com. Again, that's lifemoneyshow.com. We'll have links to Christee's email in the show notes. So if you want to reach out to her, talk to her about Medicare plans for yourself or do a review, then we are happy to help you out with that. So thanks for joining us. If you have not yet, subscribe to the show. If you found it to be of value and benefit, hit that subscribe button. That way you get notified each and every week as we're coming out with additional shows to help you, whether it be with Medicare, minimize your overall tax situation to the IRS, build wealth, feel confident about retirement. That's what we're here to do. So looking forward to that next conversation to help you enjoy life today and be financially confident about your tomorrow.
Investment advisory services made available through AE Wealth Management, LLC, AEWM. AEWM and Searns Financial Group, Inc. are not affiliated companies. Insurance products are offered through the insurance business Searns Financial Management, Inc. Searns Financial Group, Inc. is an investment advisory practice that offers products and services through AE Wealth Management, LLC, AEWM, a registered investment advisor. AEWM does not offer insurance products. The insurance products offered by Searns Financial Management, Inc. are not subject to investment advisor requirements. AEWM and Searns Financial Group, Inc. are not affiliated companies. Investing involves risk, including the potential loss of principal. Any references to protection, safety, or lifetime income generally refer to fixed insurance products, never securities or investments. Insurance guarantees are backed by the financial strength and claims-paying abilities of the issuing carrier. This podcast is intended for informational purposes only. It is not intended to be used as a sole basis for financial decisions, nor should it be construed as advice designed to meet the particular needs of an individual situation. Searns Financial Group, Inc. is not permitted to offer, and no statement made during the show shall constitute tax or legal advice. Our firm is not affiliated with or endorsed by the U.S. government or any governmental agency. The information and opinions contained herein provided by third parties have been obtained from sources believed to be reliable, but accuracy and completeness cannot be guaranteed by Searns Financial Group, Inc. Bond obligations are subject to the financial strength of the bond issuer and its ability to pay. Before investing, consult your financial advisor to understand the risk involved with purchasing bonds. Christee Jostin is an employee of Searns Financial Group and provides only insurance services. Our firm is not affiliated with nor endorsed by the U.S. government or the federal Medicare program. The information contained herein is believed to be reliable, but accuracy and completeness cannot be guaranteed.